Hi, everyone, and welcome to the PREVNet podcast. My name is Megan, and I'm very grateful to be joining you today as a guest in Mohkinstsis, also known as Calgary, on beautiful Treaty 7 territory. Today is going to be another episode in our PREVNet Research Explainer series. We're going to talk about an exciting program called WiseGuyz for boys and Masc identifying youth between the ages of 13 and 15. We're going to dig into some of the evaluation data for this program and talk about its potential to improve sexual health efficacy for those who participate and ultimately to help youth have healthier relationships. I'm joined today by Dr. Caroline Claussen, who has worked for many years in research around gender-based violence prevention. Caroline, thank you so much for being here today.
Well, thank you so much for having me. It's super exciting.
Can we take a quick minute just for you to introduce yourself and share a bit about your background?
For sure. So I too am coming to you from Treaty 7 territory. And yes, as Megan said, my name is Caroline Claussen, and I'm a research scientist with Hope Lab in the Department of Psychology at the University of Calgary. While my BA is in psychology, both my master's and my PhD are in sociology. So kind of bringing a little bit of a different lens sometimes to some of the work. And I've really been focused and specialized, I would say, in qualitative research methods, although I have dabbled a little bit in more quantitative methodologies, but not too much. And in terms of gender-based violence prevention, I've really been working in the field for more than a decade. Have worked, and I do still work extensively with SHIFT, the Project to End Domestic Violence, which is here in the Faculty of Social Work at the University of Calgary. But as well, I work quite a bit with community partners, more in a consulting kind of capacity. So different nonprofit organizations that focus on gender-based violence. So for example, YWCA Calgary, or, Big Hill Haven, which is a shelter out in Cochrane, Win House up in Edmonton, also working in Saskatchewan, supporting some member-based organizations there. So all kind of things gender-based violence. And in addition to sort of my research scientist work and my community work, my PhD research was grounded in gender-based violence prevention through studying the long-term influences of the WiseGuyz program. And that's the program that we're going to speak about more today.
So I have to say there's a ton of interest around the WiseGuyz program. I have people asking about it all the time in my work with PREVNet. So I'm wondering if you could share with our audience a little bit about what the program is and what it does.
Yeah, no, for sure. I've been involved with the program for a really long time. So like sometimes I can't believe how long I'm involved with the program, but I think that speaks to sort of the influence and the, breadth and depth of the program. But just, a little bit of background. Back in 2009, Center for Sexuality, which is quite the expert in the Calgary and Alberta landscape around sexual health education, they really noticed that STI rates were on the rise for adolescent boys. But what they didn't see was rising pregnancy rates. Actually, pregnancy rates had fallen, but the STI rates for adolescent boys were increasing. And they really started to look at this and think, well, what's happening here? And through some research, discussions, and just trying to get to figure this out, they really understood that the system has primarily focused on girls and female reproduction, and they started to ask themselves, like, well, what about the boys, right? And what they saw was that traditional programming has not always focused on boys. So in 2010 they piloted the WiseGuyz program, and from 2010 they moved into 3 schools in 2012. And since that time, they've really just ramped up their presence across Calgary, across Alberta, offering the program in multiple school districts and various community sites. And now it's even across provinces and territories. Which is super cool. In terms of boys who have gone through the program since 2010, since the first year of piloting, 1,781 boys have gone through the program in the 15 years it has been running. So this is, through school programs or community-based programs, that sort of thing. So, which I think is pretty impactful. In terms of the program itself, it's really divided in 4 different kinds of modules. So, a module around healthy relationships, so really helping boys understand, about healthy communication and, just understanding their own thoughts and sort of feelings around things. And then sexual health, they have a module on that, gender, and then they also have a module on like bystander, sort of human rights. And the program itself is grounded, like it's a very well designed program that's founded on several different theoretical models of behavior change. And it really works to support boys to really critically think about the cultural norms related to gender and masculinity. So that's sort of the essence of that program, whether they're talking about sexual health, whether they're talking about, healthy relationships. It's really around how do we help boys really critically examine some of those norms, cultural expectations, stereotypes that gender and masculinity impact. And WiseGuyz facilitators themselves, they undergo a really extensive training period. So they complete pre-readings. So for example, one of the ones is Becoming an Ally. That's by Bishop. They engage in sort of like monthly learning sessions on various topics like racism, classism, ableism. This extensive training really provides facilitators with the capacities to create really safe social spaces so that boys can have dialogue and they can really be introspective. And the facilitators are really skillful around facilitating conversations around gender stereotypes, sex and sexuality, homophobia, consent, and other topics that sometimes can be difficult to address. So, for example, how, maybe like race or socioeconomic status or something like that, other social identities can intersect with, the experiences that adolescent boys have. So the facilitators are really well trained and versed in providing this program. I think in terms of the program, like I said, one of the core features of it is regardless of sort of the content or the curriculum that they're teaching, there's a lot of opportunity for collective discussion and reflection by the boys in the group, which is such a key factor, I think, of this program. The other thing that I think is a little bit different with this program than you might see in traditional programs is there's a lot of play or, games being used, right? So it embeds opportunities for connection. And it's also, a way to kind of acknowledge that it's not a sit still and listen to me lecture kind of program. So just a lot more, I think, engaging for the boys. And just one other thing I want to mention too, in terms of the facilitators, is that WiseGuyz facilitators typically have been male identified or non-binary, although in certain settings there have been female facilitators. And generally the facilitators are sort of in their mid-20s to mid-30s. But again, in certain settings, older adults have provided programming and it's been viewed really positively. So
That's so cool to hear about the variation in the way it's delivered. And yeah, it really strikes me how important programming like this is, especially in light of sort of popular media directed towards boys that age right now. You've spoke to this a bit already, but I'm wondering if you had any other thoughts on why programming specifically for boys and Masc identifying folks is important.
yeah, I think that's such a great question. And again, it's a great question when you place it sort of against the backdrop of like gender-based violence prevention more broadly. But typically, sort of have seen that our prevention efforts have really been focused on women and girls. And I would definitely say, since the early 2000s, but more so since 2010, I would say that the engagement of men and boys in gender-based violence prevention has become more pressing, right? Because the reality is we've been working with girls and women for a long time and rates have not gone down. In some cases they have in some provinces, but sexual violence rates remain stubbornly high. So, we have to do more than talk to sort of, one group of folks. So I think this engaging of men and boys in gender-based violence prevention, conversations, programming is super critical. And one of the things that research has shown is that often violence and aggression is kind of almost normalized, a normalized part of sexual and intimate relationships. And we know that men and boys who adhere to rigid views about masculinity, they're more likely to report having used violence against an intimate partner. And holding beliefs that are inequitable regarding, gender norms and that sort of thing are also associated with using physical violence. So really overall, why the sort of focus on masculinity for boys and masculine identifying adolescents is that really these traditional social cultural norms often support or even condone the use of violence, right? um, and while I would kind of suggest that all efforts to engage men and boys to develop healthy relationship skills is like necessary and important, we definitely know that early adolescence is a really pivotal time, a really critical window to address topics like gender socialization and sexuality, because youth at this age are really, they have a natural curiosity, and it's a period where dating relationships haven't really quite started yet. They're just beginning kind of for a majority of young people. So you really have the opportunity to, kind of come in, support them to build the skills that they need, around communication and consent and conflict resolution, which are all the things that healthy relationships, require. And at the same time, really working with them to develop their critical thinking skills related to gender norms, and roles and stereotypes and that sort of thing. So I think, for this age group and for boys and masculine identifying folks, that's really important.
Great, thank you so much. So now we'll dig into some of the research here. In the paper, Promotion of Sexual Health Self-Efficacy through Gender-Transformative Intervention with Adolescent Boys, which we will link in the description, you talk about a couple of really interesting features of WiseGuyz that make it quite unique. The first is that it takes a strengths-based approach to youth sexuality.
Mhm, mhm.
And the second is that it's a gender transformative program. So, can you explain to us what that means?
Yeah, absolutely. And this is probably where some of my sociology, background will kind of come out a little bit more. But I think, despite the best intentions of parents, educators, policymakers to provide young people with information and options regarding their sexuality, it really remains steeped in a foundation of risk management, adults trying to manage young people's risk. So the curriculum typically has been focused on the development of refusal skills, negotiation skills, and birth control compliance, which typically results in young people disengaging with the curriculum because it's fear based, it's negative, and the reality is that it doesn't match their experience because, let's be honest, sex is can feel good, and that fear and sort of negativity kind of bumps up against their young people's experience. And we certainly see that the study participants talk about that in the paper. So what if instead we looked at young people as having agency, having capacity, and having competence? They're not these empty vessels to be filled, but rather, thinking, feeling agents of themselves. So, this is really where the strength based approach comes into play. And these approaches highlight the resources and the assets that youth have, as well as the positive adaptive health behaviors that they're already currently drawing on. So, these strength based approaches work to draw on these resources and assets, as well as further support youth to develop capacities to critically think for themselves, as opposed to just being passive, participants where we tell them, as adults, we tell them what to think and we tell them how to act. So certainly the strength based, I think, is so important. And that is what I would say in my experience with this program, that young people really, really connect with is that they're not being talked at, but they're being engaged with, so that I think has always been a super powerful part of the program. The gender transformative programming really fits into the strength based approach because an important aspect of gender transformative programming is to, again, support critical reflection on gender roles and norms, right? These programs offer the opportunity for participants to engage in discussions that help them challenge, resist harmful social norms. And just to kind of point out that this term, gender transformative approach, that was coined back in the early 2000s by Gupta, and it really just describes a range of interventions that promote social change around gender. So, for gender transformative approaches, the main goal is to transform gender roles and create more gender equitable relationships. And what we know over time, research shows that programs that foster gender equity, they've been found to create change in behaviors and attitudes that improve health outcomes. So by increasing healthy communication skills, by, promoting the use of condom use, all those things help improve health outcomes. So, ultimately, we know that gender transformative approaches can be impactful in supporting, men and boys to challenge and resist dominant masculinities and really working towards that goal of promoting social equality between men and women.
I love that. I love hearing about sort of the theory and the science behind it, but I also love kind of hearing about these conversations being taken sort of out of these more rigid kind of clinical spaces, and less about risk reduction and more towards a relational approach. And yeah, it's really cool. The paper, it talks about two questions that guided your evaluation of the program. So the first was, is the program improving sexual health efficacy among participants? And the second was, if so, how? So I thought we could start unpacking that a bit. If you wouldn't mind just explaining what sexual health efficacy is.
Mhm. Yes, absolutely. Um, Self-efficacy, at its sort of basic, is an individual's belief about their ability to perform a particular behavior in a given situation. So I sort of conceive of it as a middleman in the relationship between an individual's, basic knowledge and skills about performing a behavior and their actual performance of that behavior. So, for example, perhaps you learn about healthy communication skills, you learn about it. But because you don't have the opportunity to practice those skills, your belief about your ability to use those skills in a dating relationship is low. Um, you won't use what you learned about healthy communication because you don't believe or have the confidence in those skills. So, that ultimately is self efficacy. We want youth to have, good or high self efficacy so that they will use the things that they learned in actually performing the behavior. Research shows, for example, that condom use, self efficacy, so belief in, actually being able to, use a condom during sexual relationships, is linked to actual condom use. So, developmentally, many adolescent boys have a natural and healthy curiosity and readiness for sexual relationships. So, by developing their beliefs about their ability to draw on positive relationship skills and healthy sexual behaviors, that's really critical in supporting the promotion of healthy relationships. They have to not just have the knowledge, but actually believe that, yeah, I can use that in my relationships.
Great. And so I'm wondering how you went about actually answering the question of how self efficacy was improved among participants, or if it was.
Yeah. So, in terms of going about answering the questions, we used a mixed methods approach overall to the two questions. And so what that means is that we used two different kinds of data. One was quantitative, and so that means like survey based in our case. So we had a survey that young people filled out, and we also used a qualitative method, which was interviewing and focus groups. So interviews are sort of one-on-one sit downs, whereas focus groups is where you speak with multiple participants together at one time. So for the survey, we used a tool to measure the rates of sexual health efficacy. And the tool, the survey, the scale was the Sexual Health Practices Self-Efficacy Scale. So this had young people rate their knowledge, their skills, their comfort regarding 19 different sexual health practices over 5 different areas. So those areas were sexual relationships, sexual health care, sexual assault, safer sex, and sexual equality and diversity. We also examined a couple other things, like whether boys were, dating, whether they're, what their family structures were like, to see if that had any impact as well on their sexual health efficacy scores. The interviews in the focus groups, we conducted those with 2 groups of young people. Those who had never taken WiseGuyz and those that had taken WiseGuyz. And this allowed us to ask questions about the typical kinds of sexual health education provided in schools across both groups, but also to understand how WiseGuyz was perceived as being different than the typical delivery and content. Do you want me to go on to talk about the key findings?
Sure, yeah, I'd love to know just at a glance sort of what those were.
Yeah. Yeah, super interesting. And what we found was that there were very large, significant changes in the total sexual health efficacy scores, as well as small to large, significant changes across all of the subscales. We saw the largest changes in the sexual relationship scale. So, items there were things like talking to a partner about sexual health issues. Um, Safer sex also had a large, significant change, and that was, things like negotiating with a partner to have safer sex. And we saw the smallest change, but still significant, in the sexual assault subscale. So was really around dealing with a sexual assault if it occurs to you. So that was really positive, and we were super stoked to see that. Based on our discussion with boys, we heard that it really matters who is delivering the sexual health education. For sure, the young folks that I spoke with, they pick up on that inherent discomfort that many teachers have in teaching this subject. um, and they prefer facilitators who are young and who are open minded, non judgmental, and relatable. They didn't often view their teachers in that way. So, having facilitators who, had those qualities, they were much more open to that kind of programming. Our participants also really critiqued how sexual health information is delivered. They feel that, the materials are super old, they're outdated, they're old fashioned, not relevant at all to sort of their current lived experience. And they also really resented being talked at as opposed to engaged with. And, the young folks that I spoke with, they also wanted information on subjects beyond STIs and body changes. They really wanted to, explore and get into things like how to make a dating relationship healthy, sexism, diverse genders and sexualities, just to kind of name a few different areas that they were, really wanting to learn and hear more about.
That's amazing and related to something. This is a bit off script, but it reminds me of a conversation I was having with someone the other day. And they run a program for youth, and they were talking about the challenges of including boys and Masc identifying folks in violence prevention programming without alienating them. So they were kind of remarking that they feel like boys really want to have these conversations and they want to be involved, but then as soon as you start sharing the stats about gender-based violence and rates of sexual assault, people start to feel blamed and they disengage. And I'm wondering if you have any thoughts based on your work with WiseGuyz about.
I think one of the things that, why I sort of give the uh, opinion that WiseGuyz is a well designed program is because the particular sections of the curriculum are super purposeful. So either, healthy relationships is the first topic that they explore, and that is very much about having a healthy relationship with oneself. So how do I think about self-esteem and confidence, and also how do I communicate what I need or want, and how do I mitigate or negotiate conflict with a friend. These sorts of things really, I think, allow the young people to begin that process of like dialogue and critical reflection. It helps them build a relationship with the facilitators so that there's comfort, there's trust, so that when they get to a more difficult topic, which is gender, but that's only like further down the line. They've gone through sexual health, so that's another opportunity for the facilitators to start slowly weaving in, some different opportunities for reflection around masculinity, around sexism, around homophobia, all that sort of stuff. Right? They can gently start to explore some of those things before they get into the gender unit, which is much more about like, let's explore the man box, let's look at different things about masculinity. So that's, I think, a very big difference between this program and maybe your more traditional violence prevention programming, where you go into schools for an hour. So you're basically just starting off right away with the stats, the power and control wheel, and there's been no engagement and there's been no bringing them on a journey, right? So I think that's what makes this program so effective, is really like not just the content, but it's the way they structure and the process around the content, that is so critical.
And you've spoken to this a bit already in what you just shared. But I'm also thinking, obviously, the WiseGuyz program, it happens primarily in school contexts, which is its own unique context, and it's program based. But I think there are probably, hopefully, some parents and other caring adults listening today, and they may be wondering what they can learn about how they can have conversations about sexual health and masculinity with the young boys and masculine folks in their lives. So I'm wondering if you had any thoughts on that.
Yeah, totally. I mean, just doing this work for so long, and it's so interesting because I mean, I do have kids of my own, but I have two daughters. So I've worked in the world of boys for and like male identified folks for so long, so it's just kind of crazy because that's not my personal experience, but it has been my work experience. And one of the things that I would definitely say, the biggest piece overall, and this is whether you have whatever gender child you have, is really just meeting youth where they're at. And what I mean by that is they don't always want to talk to you on your timeline. So, like I said, I have two teen girls, and I certainly find that as parents, we need almost to be at our kids' beck and call mentally or emotionally, so to speak. So when they want to talk, we are always available. Sometimes it's on the car rides to activities, sometimes it's late at night when we just want to go to bed, we're tired, we're as parents, we're like, our day is ending. For them, they're maybe they've had a thought, they've had an experience, and they decide then that's when they want to share it with you. And I just always recommend like setting aside whatever you're doing in those instances, because really that's when you can have the richest conversations. It's not always most convenient for us, but if your intention is to really like engage and listen to your kids, I just really find that we have to put away our adult sort of like on my timeline and just be like, oh my gosh, you want to talk to me? Okay, I'm going to drop everything, right? Because that's just kind of what works. The other thing that I really heard loud and clear from the participants in our research is approaching them as thinking, feeling human beings. And what do I mean by that? I think really it's about not lecturing and not talking at, but using questions that help us, as adults understand. So I love using current events, like if you have the news on in the background, or if they're, I don't know, you listen to the radio or even the podcast or whatever, and asking them, if they happen to be in the vicinity, like what they think about that, what they think about what they're hearing and seeing. And instead of shutting down answers we don't like, by saying, well, don't say that, or you can't think that, actually getting more curious and asking further questions and being like, well, that's really interesting. Tell me more about that. I think, and this is a hard one, I think, for parents. And I say this as a parent, coming from a parent perspective, and as an educator, but too often as adults, we want to be seen as in charge, and we want to be seen as having all the answers. And ultimately, we are afraid of young people's sexuality. We believe they do not have the maturity to handle certain kinds of information. the reality is they are already accessing that information. So better to put aside our anxieties and discomfort with sexuality so that we can actually really engage with our young people in dialogue and create some shared understanding.
That's so true, especially in this age of information where everything's a Google away. It's such a better option to have open dialogue between caring adults and youth and them sort of who knows where they're finding that information from.
TikTok. I mean, my kids pretty much being like, "Oh, I learned everything I know from TikTok." I'm like, "Oh, let me see that."
Yeah, sometimes it's a great thing, and then sometimes you're like, ooh.
Exactly. Well, not sure if I'd go down that road, but yeah.
um, so thank you for sharing all of that. I'm also wondering if you are, it sounds like you are still connected with the WiseGuyz program.
Hmm. Yes. At this point, I'm not sure if I'm ever going to disentangle myself from this program, even though I'm always like, done feeding pizza to boys and doing interviews, but that never seems to be the case. So I'm still working with the Center for Sexuality to evaluate their implementation of the WiseGuyz program with justice involved boys. So, and that's happening in different provinces. The programs or the evaluation is set to be wrapping up in the next several months. And Hope Lab has funding to support offering the program in additional cities and provinces. So, as that moves forward, I anticipate that I'll be involved in some capacity there. So, there's a lot of exciting momentum with the program. And I just feel so fortunate to have been able to be part of its journey over the many years.
Hmm. And I suspect a lot of people listening will be really enthusiastic after learning about the program. Do you have any information for parents interested in getting their sons or other boys in their lives involved in the program, or school staff interested in bringing the program into their school?
Yeah, I think anyone who is interested in the program, whether it's parents or school personnel, really, can reach out to the Center for Sexuality to explore what could be a best fit for, your needs. They have lots of resources to offer. So, certainly not just this program, but lots of other, good and evidence-based resources. For the WiseGuyz program, I would encourage you, if you're interested, to contact Stafford Perry. And Stafford is the WiseGuyz scaling project manager. And I think that he would be more than happy to, provide some information or connect you with somebody if, he can't answer any of your questions.
Perfect. And I'll make sure those are linked in the description as well. Well, thank you so much. I feel like I learned so much about WiseGuyz, so I can only imagine how exciting and informative this was for our audience.
Oh, I hope so. Yeah, it excites me. So, like I said, after so many years.
Yeah, we really appreciate your time and your wisdom and your enthusiasm.
Thank you so much. Yes, no, my pleasure. Thanks so much for the opportunity.
This broadcast was brought to you by the Promoting Relationships and Eliminating Violence Network, also known as PREVNet. PREVNet is a national not-for-profit organization dedicated to preventing youth interpersonal violence. PREVNet collaborates with communities, organizations, educators, researchers, and youth to create and share learning resources that address bullying and teen dating violence across Canada. For more information about how you can get involved in eliminating violence and promoting relationships among youth, visit prevnet.ca.